Now, providing care and safety for mothers and newborn infants is priority number one for any facility and their healthcare staff. Joeyband by SleepBelt, a hands-free skin-to-skin support system, is helping reduce infant falls with a simple and cost-efficient solution.
The health and developmental benefits of skin-to-skin contact are so significant that the World Health Organization recommends it for all newborns. But certain child delivery methods can present challenges and obstacles for mothers and nurses.
Skin-to-skin is such a huge initiative, and it's really difficult to do, especially in certain settings like the OR, where mom is medicated, where mom doesn't have use of her arms, where if mom's lucky, a nurse or a dad will hold the baby physically on her for 15 minutes. 15 minutes is great, but the recommendation is 60 minutes of uninterrupted skin-to-skin.
Referred to as the golden hour, which is 60 minutes of uninterrupted skin-to-skin contact within the first 60 minutes of childbirth. The importance of this is linked to baby's development, breastfeeding, and bonding, and Joeyband by SleepBelt supports safe skin-to-skin in the NICU, recovery, and the OR.
So what we're excited about is that Joeyband is able to facilitate that uninterrupted skin-to-skin. Baby can be placed on mom on the table, secured with the band, and they can stay together through transport and into recovery.
When we use the Joeyband and when we do skin-to-skin with a new mom, it helps regulate the baby's body temperature, it helps regulate mom's body temperature. There's that equilibrium that exists, and it's really amazing that babies tend not to cry when they're skin-to-skin, which is great to see, as opposed to having them under the warmer.
Joeyband by SleepBelt is a patented, gentle, soft, and stretchy belt, helping keep baby positioned properly and securely. And it's providing hospitals with a simple solution to promote skin-to-skin and help prevent infant falls, impacting not only safety, but also quality of care and patient satisfaction with huge economic benefits.
We were looking for some sort of product for our operating room to do skin-to-skin with our new moms. We've been doing skin-to-skin with our vaginal deliveries for a long time, and we really wanted our C-section moms to have that experience as well.
Especially the Joeyband in an operating room scenario. New practice is to put the baby skin-to-skin immediately after delivery. That gets a little dicey in an OR. When we can use the Joeyband to secure the infant to mother's breast, babies will settle right down, and if positioned at the right angle, will nuzzle over and actually initiate feeding while the doctor's finishing on the other side of the drape. In the postpartum period, obviously a woman who's had surgery is going to be on pain medications that can make her very sleepy. And we're always saying skin-to-skin all the time. These moms often get very sleepy when they're holding their baby. So if we can secure the baby onto mom's chest with the Joeyband, there's less chance of the mother falling deep asleep and dropping her baby.
I really wish I had one of these with my first. I had a really long labor that ended in a C-section, and I was just so exhausted. I would wake up with her about to roll off of me, and with the guardrails in place even. And
infant falls are a growing problem with the skin-to-skin initiative, and they don't have to be there. The cost of an infant fall, we know from an expert witness, is $42 million for a fall, unfortunately resulting in death, and about $10 to $12 million for skull fractures. And that simply doesn't have to happen.
If we're advising parents to do as much skin-to-skin as often as possible, we need to provide them with the tools to do it safely. By sending a Joeyband home with every parent, you're ensuring that not only are they doing it safely, but you're hopefully encouraging them to do it. And that's where the long-term outcomes really improve. That's where your exclusive breastfeeding rates are going to increase. That's where the postpartum depression is going to decrease. And that's where parents are going to be bonding with their baby.
Raising awareness of skin-to-skin contact and infant falls is a challenge that the Joeyband by SleepBelt is helping to address. And this is being achieved by providing hospitals with a simple, cost-efficient solution.
It really is a big improvement for the hospital. And now with this band, we're definitely going to be increasing our skin-to-skin stats.
Our staff is really amazing. Everyone is really on board, and whatever we can do to try to make a patient's stay safer and their satisfaction better. And really, it's a win-win for mom, baby, and us as a hospital.
We know in the hospital, it's incredible that you have the aid of all the nurses and wonderful caregivers, but once you leave the hospital, we want to be there to help facilitate the safe skin-to-skin and breastfeeding, and we know that we can help parents do that safely.
What we really want to do, why we are so passionate about this product becoming standard of care, is we want to help them provide the best care possible to their mothers and their babies. Babies don't go home unless they have a car seat installed. We want to make sure that babies are going home safely and that these mothers and fathers have the tools to care for their babies properly. And Joeyband by SleepBelt is another tool to ensure safety and the best possible outcomes for these babies and their parents.
Joeyband by SleepBelt is helping to promote skin-to-skin contact with mothers and newborns, while helping to keep babies safe from falls both in the hospital and at home, providing benefits from the day they're born to well beyond. In Bridgeport, I'm Bree Bythewood.